Right, part 2 of chapter 10, looking at just the infection component of the respiratory system. All of us at some point in our lives, probably at least once a year, maybe even multiple times a year, come down with an upper respiratory tract infection. And this is actually pretty easy to do simply because of how much dirt, how many microbes are out in the world, and we are constantly breathing those in, taking those in, so it just simply makes sense that randomly, on occasion, we will get sick. Thankfully, though, with the upper respiratory tract infections, they're actually fairly mild. And all that you see listed here, sinusitis, otitis media, tonsillitis, laryngitis, can be caused by a variety of things, whether it's bacteria, viruses, sometimes even fungal organisms, but not very many fungus organisms here in this list of organisms can cause these. All right. While the same microorganisms can cause disease in all of these different areas, the name of the infection is going to be specific to the area of the body it's causing problems in. So sinusitis, it's listed here as a blockage of the sinuses, but that itis means inflammation. So there's inflammation within the sinus cavity because of the response, the inflammatory response due to microorganisms getting up into the sinus cavities and replicating to high numbers. Otitis media, infection of the middle ear. These ear infections are typically seen in young children, infants, toddlers, before their anatomy, their bodies develop, grow well enough to have proper physical anatomy to minimize the risk of developing ear infections. Tonsillitis, inflammation of the tonsils, that's typically going to be bacteria in nature when it actually causes enough problems for you to go see a physician. Laryngitis, infection of the larynx that leads to the loss of voice. Probably that's going to be more common with viral infections, and it lasts a couple of days. Maybe sometimes it's even kind of fun to lose your voice or to have that funny sounding voice. All right, but that's upper respiratory infections. And again, as I said, a lot of us experience those annually, probably. Then there's the lower respiratory tract infections. And these are less common, thankfully, because it's actually quite hard, difficult to develop these. And as you remember, looking at the trachea, where there are the cilia, there's the mucous membrane to help remove organisms that try to make their way down into the lower respiratory tract. That process is actually very efficient. You can put a petri dish out onto a desk, out on a sidewalk where you're going to be walking and breathing the air, and it will be so covered in fungal growth and bacteria growth that it's actually kind of gross. All right, I think it's okay. I like bacteria, so it's kind of fun. But you don't want these organisms down into the lower respiratory tract. All right, the lower respiratory system should be free of all organisms, unlike your digestive tract. All right, lots of bacteria, small amounts, large amounts throughout the entire system there, but lower respiratory tract, you want that clean. And so when organisms get down in there, then you typically do develop infections. And so some of the major ones here are pneumonia. And in this case, the infection occurs down in the lungs, and there can be thick fluid buildup, and this can be caused by any of the organisms, viral, although not very common, bacteria, most common, and then fungal organisms. Typically, when you see fungal pneumonia, the individual is going to be immunocompromised. So fungal pneumonia can actually be one of those diseases when that allows a person who is HIV positive to actually start moving over into that category of officially having AIDS. Then tuberculosis. This is a bacterial infection, and I think we've talked about this just a little bit. Not seen very often in the United States, although because of HIV and AIDS, the disease prevalence is increasing, as well as due to immigration, because it is still a fairly common disease in some parts of the world. Thankfully, this isn't always an infectious disease, but what happens is the person inhales the organism that causes tuberculosis. It is bacterial in nature, and it gets deep down into the lungs. It grows very slowly, and the immune system, in the process of trying to get rid of the bacteria, will actually create these tubercles. And these are collections of encapsulated bacteria created by macrophages within the lungs, and it also starts to degrade some of the lung tissue. As those tubercles get harder and get bigger, that can start to impede overall lung function. And when those tubercles get hard and get big enough, those can be seen by a lung X-ray, chest X-ray, and it can be very problematic. Then there's pulmonary fibrosis. The lungs lose elasticity because the fibrous connective tissue builds up in the lungs, and this is going to be because of irritation caused by inhaled particles. So that really is probably looking at dirt or chemicals in nature. Individuals who work in the mining field, the coal field, or the coal mining area, any of those areas where you're going to be breathing a lot of dusty or dirty air. All right, so not so much microorganism induced, but rather just dirt in general. All right, then there's emphysema, asthma, lung cancer. Those are disorders within the lower respiratory tract that, with lung cancer and with emphysema, probably going to be due to smoking in a lot of cases, especially with emphysema. All right, chronic incurable disorder in which the alveoli themselves are damaged, and so then you have a decreased surface area for gas exchange, and the lungs don't work properly. So it's difficult for a person to breathe, to push air out, to get air in, and then there are the residual side effects of your body just simply not getting enough oxygen. Asthma can be caused by a variety of things. All right, here you have constriction of the bronchial tree, and you have the inability to pull air in. So there's breathlessness, there's wheezing, coughing, really as a response mechanism of the respiratory system. This can be caused by allergies. It can be caused by even cold air, whatever is going to irritate the bronchial tree to cause that constriction. Lung cancer, uncontrolled cell division, which we've talked about a little bit in terms of the uncontrolled cell growth of cells that are becoming cancerous. Probably in almost every case, this is going to be caused by smoking. Probably in the 1980s was when scientists and physicians really started to take notice of the effect of secondhand smoke. And at some point during that decade, I believe, was when smoking was banned from airplane travel. And the reason for that was that a lot of the flight attendants who had never smoked before in their life we're coming down with all these lower respiratory issues, including lung cancer, again, typically seen by those who smoke. But unfortunately, the secondhand smoke causes similar identical effects as it does for smokers, just not quite as extreme because there's less direct contact with the smoke. But secondhand smoke's still a major problem. All right, here's just a diagram of those different diseases. All right, the pneumonia, the alveoli filled with pus and fluid, making gas exchange difficult, pulmonary fibrosis. You have the issue with the fibrous connective tissue that builds up, reducing their elasticity, reducing the ability to move air in and out of the lungs. And in this case, you have asbestos causing that problem. Then you have tuberculosis. And in this picture, it says pulmonary tuberculosis because you can actually have those tubercles build up at other places in the body. But typically when one hears about tuberculosis, they think of the lung disease. Emphysema, asthma, and then bronchitis. So you want to try to keep your respiratory system as healthy as possible, breathing clean air. And unfortunately, it's hard to avoid organisms because we don't intentionally ever try to come into contact with something, but randomly, it just is the perfect storm, so to speak. The organism gets into your body and it makes its way down and actually causes a problem. So this concludes the respiratory system.